Well, good morning, everybody, and thanks for taking the time out this morning to attend the webinar on the Lead Advantage Pro program. My name is Leonard Berthelsen. I handle all of the health market products here at Financial Brokerage. Today, we're going to talk about, as I just said, the Lead Advantage Pro program. This is a quoting and client management program specifically designed for the Medicare products. I think you're going to find it to be very informative. We've got the folks from Lead Advantage Pro talking this morning that will give us really good insight into how the program works, how you quote from it, how you're able to do applications right from the quoting tool. So there's a lot of things that Sean is going to go through this morning with you. With that being said, I'm just going to go ahead and turn it over to Sean and let him take it away from here.
Hey, thank you, Leonard. Yeah, really appreciate it, and thanks for having me today, and thank you everyone for attending. As Leonard mentioned, I'm going to spend the next 30 to 40 minutes doing a high-level overview of Lead Advantage Pro, and this system is all, as Leonard mentioned, designed to make your life easier, make selling Medicare products easier, and this system is really designed to fit any style of selling, meaning whether you're selling over the phone, you're meeting face-to-face with the client, there's functionality within this system that will improve the overall sales process and help you be more efficient. This system is really all meant to solve everyday business challenges that you run into. You think about some of the challenges you may have today. You run out of supplies. Looking up your client's list of prescriptions can take a lot of time. Determining if your client's doctor is in network can be a pain point. Whether you're selling over the phone can be a struggle. And so we've really taken technology to solve for those pain points and to make the overall process that much easier. The other thing to keep in mind with this system before I jump in is this system is really designed to take you from lead to sale. So you can use this system for managing leads, running quotes, facilitating the enrollment, and ultimately making the sale, all within this system. So you don't have to use multiple quoting tools, or you don't have to log into the carrier's e-app. It's a pretty seamless process as you go through the steps here. So I'll walk you through some of that just to kind of take you from lead to quoting to enrollment, show you how you can make the sale, and hopefully you'll find some value in some of the tools that I'm going to walk through. Now, when you log into Lead Advantage, and oh, by the way, I know Leonard will tell you at the end how you can get set up for this. So as I'm going through this and you want an account, we can get you going right away after this, and Leonard will show you how to do that. When you log into the system, you're presented with what we call the dashboard. This is really meant to give you just a high-level snapshot of your overall lead activity. So if you are using the system for lead management, this will show you how many leads you have in the system. It'll show you the lead breakdown by geography, the product mix. Are you selling MedSup, Part D, Medicare Advantage? And then also the number of leads by dispositions. The dispositions are totally customizable. So you can really just kind of keep track, organize your leads, understand, did I leave a voicemail? Was this a bad lead? This dashboard will present that information to you. Now, there's a number of different ways you can get leads into the system. You can manually enter in leads. It's really easy to do. Just next to leads, you can hit on this plus or addition sign, and you can enter in the lead information right on the phone with the client. If you have client information, or even if you're working Attorney 65 lists, if you have client information on an Excel format or a CSV file, you can easily import that information into the system. So under the Admin tab, there's a lead section, walks you through how to do that. There is also a number of lead vendors that we're partnered up with as well. So chances are, if you are purchasing leads from a vendor, you let them know that you're using Lead Advantage Pro. In many cases, that vendor can sync those leads right into the system. And if there's a vendor that we don't work with, good chance we can get partnered up with to make that connection. Now, I have a couple of leads already entered into the system, just a couple of test leads. I'm going to jump into it. So Mr. John Doe here. And this will give you, when you click on the lead, it'll give you just a summary of the client profile. You can certainly click on the client's name just to fill in additional information. I already have a lot of this information pre-filled in, but as you're talking with the client, if you find out, you're missing the address, you can fill that in on the fly. And then this is also just a great place to store the Medicare number, Part A, Part B effective date. The Medicare number is not as easy to remember as it used to be. And I always say, take the time, fill out as much information within the client's profile as you can, because once it comes to running the quotes, filling out the enrollments, this information is going to carry over. So the more information you can fill in here, the less you're going to have to do, the less the client's going to have to do. And then also, this is just a great way to keep a record of this client as well. Now, there are some basic CRM functionality built within here. So under the conversation log, you'll have a number of different options. You can send an email, you can make a task, you set an appointment, make notes, or create a disposition. So you can send emails right through the system to the client. It will actually store those emails in here, so you can retrieve it at a later time if you need to. If you're talking to this client as an example and you determine maybe they're not eligible for Medicare yet, they're still working, you can use this system just to note that in here. And then maybe you'd want to set up a task to follow up with them when they are a little bit closer to that retirement, so you can talk to them about their Medicare needs. So you'll find that there's a number of different options on here just to help you kind of manage the overall leads that you are working. And then the dispositions, you'll see that we have dispositions for almost just about every scenario you would potentially run into. Whether you set an appointment or it was a bad lead or the policy issued, you name it, whatever the outcome is of this lead or this client, you can indicate it through this disposition. And these are customizable too. So if there is a disposition that's missing that's important to your business, we can always get that added in as well for you. Now, the power of this system really comes in the quoting and enrollment. In my opinion, that's kind of where the power is in Lead Advantage. So you'll see to the right of the client's name a number of different options. You're going to have the ability to run quotes for MedSup, Medicare Advantage Part D. Next to that, you'll have the option to complete the electronic scope of appointment. And then we're also integrated with the Medicare Blue button too, which I'll explain in just a moment. But let's use this client as an example. And client, initially they're interested in MedSup. So let me show you first here the Medicare supplement quote. All we need to do is hit on this quote button, select Medicare supplements. And as I mentioned, because we already had the client's information filled out within the profile, all of that information is going to carry over. The only thing you would need to change is potentially if the client is eligible for a household discount, you can toggle that on to yes if you want the discount included. And then it will also ask if the client is in their open enrollment or guarantee issue situation. You can indicate that. And then last but not least is the client a tobacco user. So once we have those fields filled in, we can go ahead and get the quote. And this panel on the left you can collapse it by selecting these three lines here. And this will collapse it just to make the quote results page a little bit bigger. And you'll see on the top we have a bar here, so you can see exactly the quote inputs that were entered in to determine and run this quote, as highlighted here on the top. And then as we scroll through the list, you'll see that the plans are all grouped together. So we have all the Plan Fs grouped together. We have all the Plan Gs grouped together. And this is sorted by the carrier with the lowest rate. Now, this tool is great for just determining what the rate is, but a couple of the other kind of nice features built around the MedSup quote is you have the ability to email this quote. So using that same example, client isn't eligible yet for Medicare. Maybe you want to send them a quote just to start reviewing some of the information for when you talk to them next. You think maybe Plan G may be the right way to go. So you can simply just check off some of the lowest or carriers that you would want to recommend to the client. Check those off, and then you're going to have the option right on top here to email that quote to the client. Email is already typed out. All you need to do is hit send, and then when the client clicks on the link, they're going to be able to view the quote results page just like you're seeing it on my screen. So that's a nice feature there. The other thing that's really nice is we have all of the forms really right at your fingertips too. So maybe you're interested in, Mutual of Omaha, for example, the United World MedSup. You'll notice a couple of icons here off to the left. And so this first one, the plan documents, is simply just a way for you to get the forms. And this will pull up really any form that pertains to this Mutual of Omaha MedSup plan. So if you're talking to the client and maybe you just need to refer to the outline of coverage, you can open this up, pop it open right here, and you'll have it download right away. Maybe this is something that you want to send to the client along with the consumer brochure. You can check off any of these forms and then email it off to the client as well. Even
Yeah, Sean, can I just point out one thing for folks to understand?
Absolutely.
In the Medicare supplement world, the rates are all based upon the zip code that you enter into the system. So once that's entered in there, the system will recognize which product with a particular company is available. In the case of using the example of Mutual of Omaha, they might. Mutual has 4 or 5 different companies that they write MedSup business through, and it may be different from state to state. But based on your zip code, it will pull up the correct rating for that particular product. And when you go to the form section, if that's what you're looking for, it will only pull up the forms for Mutual of Omaha or United World or Omaha Insurance Company. Whatever product they're currently selling in your state or in that state that you've indicated, those forms will come up, and only those forms. So you don't have to worry about doing an app on a wrong form or sending the wrong form to the client. Makes it very easy. To me, there's a great deal of comfort in knowing that, hey, the system's given me exactly what I need, and it's the correct form. So back to you, Sean.
Yeah, thanks, Leonard. Thanks for pointing that out. Yeah, there's enough for all of you on the call to know just as agents. And last thing we want you to worry about is are you quoting the right rate, or are you quoting the right entities? So to Leonard's point, there's a lot of value in that. MedSup carriers change out entities quite often. So yeah, good call out there. Now, this tool also, you'll notice there's some icons under some of the carrier names. So you can click on here too, and this will give you details on the household discount, if there's a policy fee associated with the carrier. It's also going to give you some visibility into that too, which is really helpful. Now, if the client is ready to sign up, you'll see we have a couple of other icons here to the left of the carrier name, and these all represent different enrollment options. As I hover my mouse over, you'll see that it pops open with a message. It explains what that enrollment method is and what scenario you may want to use it in. So you can do that on both of these. The first one, PDF, it does exactly what it says. It just opens up a PDF of the carrier's application. But what's nice about this is it's a fillable PDF. So it makes it real easy for you to jump into the quote to now filling out the application. Because we already had the client's information in the system, you're going to see, just like with some of the other tools that I showed, the information carrying over. Even your information as the agent, your name, your agent writing number, is automatically applied to the application as well. So So you don't have to go search for that writing number. It's all put on there. Now, as we scroll through this, you can see a lot of the information is filled out. Plan is already selected. And so now it's just a matter of going through and filling in any of the missing fields. And you can see you can just go through the app, fill it out with the client. So this can really be used, if you're meeting face-to-face with the client, you can fill it out, print it off, have the client physically sign it. Maybe you have a client that wants to receive the application in the mail. You can fill it out, print it off, mail it to them. Or you can easily just email it to them as well. So once you have this filled out, click this save icon in the upper right-hand corner or the submit icon, and you'll see that it gives you the ability to email the application along with the forms right to the client as well. So once the client gets that email, they would just have to, again, review it, print it, sign it. And so a couple of different ways you can use the PDF option if your preference or the client's preference was to use the paper version of the application. Now, the e-app definitely has been picking up more and more adoption with carriers across the board. So we definitely see more agents using the e-app, but we want to include both options out there. Now, if your preference is to use the e-app, you'll see that we do also have that option here. So to jump into the e-app for Mutual of Omaha, just click on that e-app icon. And this will simply just single sign you into the Mutual of Omaha e-app. So for those that sell with Mutual, this should look very familiar. Brings you right to the e-app. My writing number is tied to it. Client information is already carried over, and you can just jump right into completing and submitting the e-app. So this is all about saving time, right? So this prevents you from having to use a quoting tool, log out of that, log into the Mutual site, find the e-app, re-entering it. It's just a simple, seamless process to save you time and get you through the sale there. So those are essentially some of the high-level highlights on the Med Sup side. I'm going to jump back over to the Medicare Advantage side, and let me go back to the client's information here. So I know several, if you're helping the client with the Med Sup, you very well are probably helping them on the prescription drug plan too. Or maybe the client has interest in Medicare Advantage as well. And so some of the tools that are designed and available in the system for Part D and Medicare Advantage, I'll walk through next here. So before you even start having a conversation about prescription drugs and Medicare Advantage, you always need to get that electronic scope of appointment form completed. And we have a really easy way to do that in Lead Advantage. So next to the quote page here, you'll see where it says SOA, Scope of Appointment. To send this to the client, you simply just have to hit on this plus or addition sign. It's going to ask you for the appointment date. I'll just select today, initial method of contact, and then it'll also have you sign your name as the agent, which will act as the electronic signature on the form. So let me send that off to the client here, and I'll show you what it looks like from the client's point of view. And this is just one way to do the scope, of course. If you already did it, you're not necessarily required to do it through this system, but just from what I've seen, this is a real quick, easy way to do it. So the client will receive this email. It will instruct them to click on this link here. Security purposes, they're going to just have to enter in their date of birth and zip code. Let me see what email. Oh, I had 688116. And so for those that have worked with Part D Medicare Advantage, this should look pretty familiar. This is just a generic scope of appointment form. We try to make it as simple as possible for the client. We already have the products pre-checked off, so the client doesn't have to check any of those off. information is already carried over at the bottom, so the client doesn't have to re-enter it. So the client just has two steps. They have to sign the form, where you see this big bright yellow bar here, and then lastly they would hit the submit button. So client just signs it, hits submit. They're going to be presented with this screen that says the form is submitted, and they're done. That's all that needs to be done to complete the scope of appointment form. And best practice, I always recommend, and most agents will just hang on the phone while the client goes through those steps, just to make sure the client received the email. If there are any questions, you can answer them right away. But you can see it really takes under 3 minutes to do it. Now, you will get email notifications along the way as well. So if for some reason you can't hang on the phone, you'll get email notifications when the client clicked on the link, and then also once they submitted it. Once it is submitted, you can go back here on the client screen, and now you'll be able to click on the SOA button, and it'll be time date stamped, and you'll have the ability to view the scope of appointment. So if a carrier does want the scope printed off or sent in with the application, you can easily do that from here. Otherwise, this is a great tool for just satisfying the CMS requirement of having to retain the scope for 10 years. This will retain it, and down the road, if a carrier ever asks for the form, you can simply just search for the client's name. You'll be presented with this screen where you can retrieve the scope. So again, real quick, easy way to complete the scope. Now that we have that completed, let me go ahead and jump into the quote for Medicare Advantage and Part D. And you'll see here we have some options here on the right. Medicine cabinet, pharmacy list, as well as the provider list. So to run an accurate quote, to really give the best recommendation to your client, of course for Part D and Medicare Advantage, for Part D you always want to enter in the prescriptions that the client is actively using. You want to add the pharmacy where they're getting those meds filled. And then if you're selling Medicare Advantage, you're also going to want to add in the providers too. Now, if you're working with a client and maybe they only have 1 or 2 medications, you can simply just manually enter those in. That's probably the quickest way to do it. Search those medications. I just entered in an example one here. It'll ask you for the dosage, quantity, and frequency, and then you can add that to the medicine cabinet. So you'll see that this medicine is now listed. We have it checked off, so this medication will be taken into account for when we run the quote for the cost estimates. Now, we have some pretty nice tools here. So if you run into an example of a client that is on 10, 15 medications, maybe the client forgot their list of medications. Maybe they're really just struggling spelling out the names of the medications to you. We have a couple of tools in here to make your lives a little bit easier and to validate the accuracy of the drug list. The first one is called RX Import. And the other one is called Medicare Blue Button. With both of these tools, what it will do is it will import the client's list of medications automatically into the medicine cabinet, eliminating the need for you to manually enter them in. Not only will it pull in the list of medications, it will also pull in the providers that prescribed those medications, as well as the pharmacies where they had those medications filled at. So a lot of helpful information right at your fingertips, really before you even get into the quote results. In order to do that, you have to get consent from the client to access that information. And there's 2 ways you can do that. So as mentioned, one way is RX Import. So with the RX Import, the consent process is done through an 800 number. So when I click on this, it's going to pop open the 800 number as well as the customer ID number. The client can call this on their own, or really best practice, do a 3-way call with the client. It's a recorded line, takes 90 seconds to complete it, and the client is just verbally providing their consent. Once you have that consent, it will then pop open a screen that shows every medication that was pulled in, the doctor information, and the pharmacy, and that information would then be pulled in to the fields listed here on the quote page. Now the blue button, that was on the previous screen where we saw the scope of appointment. If you want to initiate the blue button, the way the consent process works on this is it sends an email to the client. When the client receives that email, they're then instructed to log into their mymedicare.gov account, pops open a box for the client where they just have to check off to authorize consent for you. So for those that aren't familiar with Medicare Blue Button is the same technology that Medicare.gov uses. So when a client logs into Medicare.gov, they have access and they can view really all the claim information, including their prescription drugs. And so that's what this is doing. It's just a way for you to ask for consent to access their data that is provided to them on Medicare.gov. So essentially, RxImport Blue Button, it accomplishes the same thing. Differences are one consent is done through email, the other one is done through an 800 number. The other main difference is Blue Button will only work if a client is already enrolled into Medicare because it's all based on claim data. RxImport would work with somebody whether they're on Medicare or not. So if you're working with somebody turning 65, RxImport would be the way to go, just as an example. So I know that's a lot of information, especially if you're just hearing it for the first time. But best practice, try it on yourself. Go through RxImport. You can do it on yourself, kind of get a good feel. It's one of those things, once you start using it, you really get a hang of it, and you probably won't want to go back to doing it the old way because you'll see how much time it saves you, and then also just validating the accuracy of the list too. You could even use this on MedSup too. If you're doing an underwritten MedSup, you need the drug list. This is another way you could get it for that as well. I'm going to leave this one medication entered in here just for example purposes. So next step, we would want to add in the pharmacy. You can search the pharmacy name, or you'll just do a radius search. Let me go ahead and just select CVS here as an example. So you can leave it just like this if you're selling only prescription drugs. However, if you are looking at Medicare Advantage as well, you may want to add in the providers too. So what this will do is by adding in the providers, when we get to the quote results page, it will tell you plan by plan if that provider is in network or not. So let me enter in a couple of examples. I'll enter in a primary doctor. You can select specialist as well as hospitals. So I'll select a hospital as well. Go ahead and do the first one here. Let's save that to our list. And so now we have the drugs added, the pharmacy, as well as the providers. You can change any of these fields here too. So if you need a different effective date, if the client has low income, if they're receiving extra help, you can indicate that here as well. But let's go ahead and get the quote here, and I'll walk you through the results here to give you a feel for how this works. So the way this is going to be displayed is it'll be the tabs will each represent different products here. So the first tab is standalone prescription drug plans. Next to that, we have MA Medicare Advantage with prescription drug benefits, Medicare Advantage only plans, as well as special needs plans as well. So I'm on the Medicare Advantage tab right now. First thing I'll show you is just how that provider lookup tool works. So as we scroll through the list of carriers being displayed here, you're going to see this circle icon to the left of each plan, and this will show you what providers are in network or not. So a red circle would indicate that none of the providers are in network. If we had an orange circle, that would indicate at least one provider is in network, and green would indicate that both or all of the providers are in network. So as I scroll through the list, you can see we have some that are orange. I don't see any that are green. Let's say, for example, purposes, client was interested in this United Healthcare plan. You can click on this icon and this will give you some more information. So this shows that the primary doctor that we selected is in fact in network, but the hospital that we selected is out of network. So you could simply just keep looking for a plan that covers both. However, if the client was comfortable changing the hospital out, you can change it out, and it will pull up a list of hospitals that are in network for this specific United Healthcare plan. So if the client was okay switching it out, you can replace the provider. It's going to rerun the quote results, and we should see that United Healthcare plan now show green, indicating all of the providers are in network. And you can sort these on top. And I think that was the plan I was looking on. For some reason that did not switch over. You never know what's going to happen in a live demo. Yeah, I don't know why that didn't switch over here. I'll see if it does it one more time. Otherwise, I will move on and check to see what's going on there. But you kind of get a feel for how the tool works. So what that should do is turn that green, indicating that both providers are in network. Let me jump over to the Standalone Part D plans as soon as this quote results shows up here. And so this will show you essentially what you would expect out of a quote page. Monthly premium, deductibles. It'll show you the in-network cost based on the prescriptions that we entered in and the pharmacy that we selected. So it'll do a side-by-side comparison there. So like this Humana plan, for example, it shows cost is $272 if we go to an in-network pharmacy of Humana. CVS is not considered preferred for Humana. So this question mark, if you select on this, this will show you a list of the preferred pharmacies within the Humana prescription drug plan network. If you needed additional details for any of these plans, we have this plan details here at the bottom here. And this will give you just about all the information that you would need. You know, what's the cost for mail orders? Is my client going to enter in the donut hole or coverage gap? Monthly breakdown of costs. This can be printed out as well. You can also email this quote out just like I showed you on the MedSup side. You're going to have access to all of the forms, the PDFs, very similar to what I showed you on the MedSup side as well, along with the e-app. However, on the prescription drug and Medicare Advantage side, you're going to have access to two additional enrollment methods. The first one is called ACO, and the other one is called F2F, which stands for face-to-face. Both of these methods are ways of submitting the application electronically. The only difference is face-to-face is if you're meeting face-to-face with the client, and ACO is if you're selling over the phone. So I'll show you this here quickly. ACO, if you are selling to this client over the phone, easiest way to do this is I'll show you here. It brings up the enrollment form. You're in full control of this. So you're filling this out with the client as you're talking to him on the phone. And you'll see client information is carried over. So it's just a matter of going through the application here. Medicare numbers carried over. We need to put in the effective date. And I mainly want to just show you the signature process of this app at the end. So these would be the same questions that you saw in the paper app, and you can see on the top, it's taking me through 4 steps here. So the last step is review and submit. And so for the client to sign this, as you're filling this out at the end, it's going to give you the option to send it to the beneficiary. And you can either email it or text it to the client. And so when you do this, the client will get an email or a text. It's going to have a link as well as an authorization code. And then when they go to that link, they just have to enter in the code. And then they're going to be presented with this exact screen that you see here, where they can review the information that you entered in. And then they simply would just have to submit the app. So that could be done on a desktop if they get the email, or a computer or a tablet, or it can be done on their mobile phone too if they have a smartphone and you want to text it to them. The other option here, face-to-face, works very similar. Again, the difference is that you're meeting face-to-face with the client, and it's going to take you to the same enrollment form that I just showed you with ACO. So it all just comes down to how you're meeting with the client and how you're selling. Same enrollment form, and then at the end, you would turn your mouse over, client could submit it, or if you're on a tablet, they could use their finger to sign it as well. Now, what's really nice about ACO and face-to-face is I scroll through, you'll see that it's available for just about every one of these carriers. And so the learning curve is really easy. I mean, once you understand how to do it with one carrier, it's the same process with every other carrier. So it's a lot easier than having to learn each carrier's e-app. You know, once you're used to using ACO with one, it's the same with the others. Last thing I'll show you on this, because this is a really helpful section, something that's used quite a bit here in Lead Advantage is the form section. So if you simply just need to access the carrier's application, whether you ran out of supplies or you just like the PDF versions to fill out, the form section, you can go in here, just select the product type, plan year, if you're doing Part D, the state, and then the carrier. So if I select Aetna, get forms, this will pull up all the forms that you need, and then most importantly, the enrollment form. You can download that, have it right at your fingertips as well. So I know we're right at time here, so I'll end it there. Leonard, unless there's anything else you wanted me to cover, otherwise I'll turn it back over to you.
Thanks, Sean. No, did a good job again. Just a couple of things in closing. Some folks only sell Medicare supplements, and that's fine. The system will work well for doing just that. If you're selling Medicare supplements and you're enrolling somebody that does require full underwriting, being able to have that prescription drug interaction within the system makes a lot of sense. And so use it for that purpose. For those that are in the Medicare Advantage or the prescription drug program, just remember and be aware that does require a separate certification. That needs to be done prior to selling of any of those Medicare Advantage or the PDP prescription drug plan programs. And then finally, for getting agents access to the Lead Advantage Pro, it's a very easy step. You go to the Financial Brokerage website, which is www.financial-brokerage.com. And right there on the very first screen will be the Lead Advantage Pro. We're promoting that and making that kind of the premier thing right now. You click on that to register. Once you do, you get the information, input it in there, hit submit. It can take up to 24 hours before you get the registration link to be able to access the program. But the first step is to get registered, and that's how you do it, directly right from our website. I know there was a lot of information that was presented this morning. You're not going to be an expert at all of it right from the beginning, but as Sean said, spend some time once you're registered and you have access to the site. Spend some time, get kind of familiar how it works and how you navigate from one area to the other. You're going to find it to be extremely useful. I've been doing Medicare supplements for longer than I want to admit, but I use the carrier's e-app. It's one of the slickest tools that carriers have come up with, in recent time. I don't do paper apps at all anymore. It's great because I can have the client on the phone and fill it out, right when they're on the phone, and I do it on the computer screen when I'm done. I hit the submit, goes over to them to do the electronic signature, and we're good to go. So this is an all-inclusive. I don't have to go to a separate carrier website in order to get that e-app. This does everything for you from that standpoint. So any questions, by all means, reach out to us. We're here to help in any way that we can. First step for you after the webinar today is to get registered. Go to our website, and you can accomplish it there. So with that, I want to thank Sean for taking the time this morning. I want to thank the folks that are on the call for attending. We hope that it's been useful for you. We wish you good selling in the future. And again, any questions or concerns, just give us a holler. That's what we're here for. Thanks.